Somebody said it to you on the telephone, probably. They asked whether you had a cold or whether you were tired, and you said no. And then you thought about it afterwards and realized that your voice has not sounded quite right for some time. It may have become hoarse or breathy or weaker so that you cannot make yourself heard across a room the way you used to. It may have become higher or lower in pitch. You may find that it tires by the end of the day, or that you have to clear your throat constantly, or that talking on the phone has become an effort. I want to talk about voice today because it sits in a strange gap. It is one of the most personal things about us. It is central to how we connect with other people, and its loss is genuinely isolating. And at the same time, it is one of the symptoms people are least likely to mention to a doctor, partly because it seems trivial, and partly because it comes on so gradually that nobody notices the moment it changed. And there is one specific rule I want every person watching to take away, which is that hoarseness lasting more than 3 weeks needs to be examined without exception. And I will explain exactly why that rule exists, because it is the single most important thing in this video. And it is genuinely not widely known. So today, I'll explain how your voice is actually made and what aging does to it, the causes of a changed voice from the ordinary to the important, the 3-week rule and the reasoning behind it, what an examination actually involves, and the practical measures that genuinely help. Let me begin with the mechanism. Let me explain how your voice works, because it is more mechanical than most people imagine. Sitting at the top of your windpipe is your larynx, your voice box, and stretched across it are 2 folds of tissue, your vocal cords, or more properly, your vocal folds. When you breathe, they sit apart to let air through. When you speak, they come together, and air pushed up from your lungs sets them vibrating extremely rapidly, and that vibration is your voice. The pitch depends on how tense and how thick they are, and the resonance and character of your voice come from the shape of your throat, mouth, and nose above them. Now, 3 things are required for a good voice. The folds must come together completely, because any gap allows air to escape unvibrated, which produces a breathy, weak voice. The tissue must be supple and well lubricated, because stiff or dry tissue vibrates poorly, which produces roughness. And the nerve supply must be intact, because each fold is moved by a nerve that takes a remarkably long and vulnerable route. And I'll come back to that because it matters. So your voice is produced by 2 folds of tissue vibrating as air passes between them, and it needs them to close completely, to be supple and moist, and to have an intact nerve supply. Now, what does aging do? There is a genuine and recognized phenomenon called presbyphonia, meaning the aging voice, and it is caused by several changes. The muscle within the vocal folds thins and weakens in the same way that muscles throughout your body do, which is essentially sarcopenia of the larynx. The tissue layers of the fold lose their elasticity, and the lubricating layer thins. The cartilages of the larynx stiffen and can partially calcify. And, importantly, the folds become slightly bowed so that when they come together, they no longer meet completely along their whole length, leaving a small gap, and that gap is what produces the characteristic changes. So the typical aging voice becomes weaker and quieter, breathier, because air escapes through the gap, less able to project across a room, more easily tired, and it may change pitch, with men's voices tending to rise slightly and women's to lower. Alongside that, reduced lung capacity and weaker breath support mean shorter phrases, and reduced hydration and drier tissues make everything worse. So some voice change with age is normal and expected, and it is caused by thinning muscle and slightly bowed vocal folds that no longer close completely. But, and this is the crucial point, normal aging produces a gradual symmetrical weakening over years, and it is not the explanation for a hoarseness that appeared over weeks or months, and it is never a reason to skip an examination. Let me now give you the causes, and I'll start with the common and mostly benign ones. First, acute laryngitis, from a viral infection which is by far the commonest cause of a hoarse voice and which settles within 1 to 2 weeks, and which is not what this video is about. Second, and this is one of the biggest and most missed, acid reflux, and specifically the form that reaches the throat, which I mentioned in another video. Stomach acid and enzymes irritate the delicate tissues of the larynx. And the crucial point is that a great many people with this have no heartburn at all, which is why it is called silent reflux. Its picture is characteristic, and it is worth learning. A hoarse voice that is typically worst in the morning and improves through the day. Constant throat clearing, a sensation of a lump in the throat, a chronic dry cough, excess mucus, and postnasal drip, and a sore or burning throat. If that is your pattern, reflux is a strong candidate. And the measures I described in my heartburn video, particularly raising the head of the bed and not eating within 3 hours of lying down, are the treatment. Third, vocal overuse or misuse, meaning too much talking, shouting, or speaking over noise, which produces swelling and eventually nodules or polyps on the folds. Fourth, smoking, which is a major cause of chronic hoarseness through a condition called Reinke's edema, where the folds become swollen and boggy, characteristically producing a very deep, gravelly voice, particularly noticeable in women, and which is entirely caused by smoking and improves on stopping. Fifth, dryness, from dehydration, mouth breathing, or the drying medications I described in another video, because dry folds vibrate poorly. And sixth, inhaled steroids, used for asthma and COPD, which commonly cause hoarseness and thrush of the throat, and which is why you are told to rinse your mouth after every dose, a step a great many people skip. So the common causes are viral laryngitis, silent reflux with its morning hoarseness and throat clearing, vocal overuse, smoking, dryness, and inhaled steroids. Let me now give you the medical causes that need finding. First, an underactive thyroid, which causes a low, hoarse, gravelly voice as part of the general slowing I described in my thyroid video, and which is easily tested and easily treated, and this is a genuinely common and satisfying diagnosis. Second, a vocal cord palsy, meaning paralysis of one vocal fold. And this deserves proper explanation because the anatomy is important. The nerve supplying each vocal fold, the recurrent laryngeal nerve, takes an extraordinary route because rather than going directly from the brain to the larynx, it travels down into the chest and then loops back up. And on the left side, it loops all the way around the arch of the aorta, the main artery leaving the heart, which means that anything in the chest along that path can damage the nerve, including a lung tumor, an enlarged lymph node, an aortic aneurysm, or an enlarged heart chamber. And this is why a hoarse voice can genuinely be a presenting sign of chest disease. It also occurs after surgery, particularly thyroid surgery, and after viral infections, and sometimes for no identified reason. And its picture is a breathy, weak voice with a poor cough, and importantly, sometimes choking on liquids, because the fold that will not move also fails to protect the airway during swallowing. Third, neurological conditions. And there are two worth naming. Parkinson's disease, in which the voice becomes soft, monotonous, and lacking in variation, and where reduced voice volume is genuinely one of the early features, often noticed by family before anything else. And a condition called spasmodic dysphonia, which produces a strained, strangled, or intermittently breaking voice. Fourth, myasthenia gravis, which characteristically produces a voice that fades with prolonged talking and recovers with rest. And fifth, and most importantly, cancer of the larynx or of the surrounding structures, which brings me to the rule. So the medical causes include an underactive thyroid, a paralyzed vocal cord which can signal disease in the chest because of the nerve's extraordinary route, Parkinson's disease, myasthenia gravis, and cancer. Now, let me give you the rule and the reasoning, because this is the most important part of this video. Hoarseness that persists for more than 3 weeks without an obvious explanation such as a recent cold, needs to be examined by a doctor, and the examination should include a look at the vocal cords. And the reason this rule exists is straightforward. Cancer of the larynx presents in the overwhelming majority of cases as persistent hoarseness, and often as nothing else at all for a considerable period. It is not usually painful in its early stages, there is no lump to feel, and there is nothing to see from the outside. So the voice is the only symptom, and it is the earliest symptom, and the outcome depends enormously on when it is found. Laryngeal cancer caught early is highly treatable, frequently with excellent preservation of voice function. And caught late, it requires far more extensive treatment with far greater consequences. And the risk factors are the ones you would expect. Smoking, above all, whether current or past, heavy alcohol, particularly in combination with smoking where the risks multiply rather than add, being male, being over 60, and increasingly the HPV virus for some cancers in this region. So the practical rule is this: 3 weeks, no exceptions, and it applies with particular urgency to anyone who has ever smoked. And let me give you the associated symptoms that make it more urgent still. So hoarseness alongside any of the following warrants: prompt attention, difficulty or pain on swallowing, a sensation of something stuck in the throat, a lump in the neck, as I described in my neck video, unexplained ear pain on one side with a normal looking ear, which is a classic referred symptom from the throat, coughing up blood, unexplained weight loss, and noisy or difficult breathing. So the rule is 3 weeks. The reason is that laryngeal cancer presents as hoarseness and often as nothing else, and it is highly treatable when found early. Let me tell you what the examination involves, because fear of it puts people off, and the reality is straightforward. The essential step is that somebody needs to look at your vocal cords, and there are 2 ways this is done. The older method uses a small angled mirror at the back of the throat with a light. The modern and more usual method is a flexible nasendoscopy, which sounds alarming and is not. And it involves passing a very thin, flexible camera through your nose and down to the level of your voice box. Local anesthetic spray is usually used. The whole thing takes a couple of minutes. It is done sitting up in a clinic chair, and while it is undignified and mildly uncomfortable, it is not painful, and it gives a clear view of the vocal cords in action. This is the examination that answers the question. And if you have had persistent hoarseness and nobody has looked at your cords, then the question has not been answered. Alongside that, depending on the findings, you may have blood tests, including thyroid function and imaging of the chest if a vocal cord palsy is found. Since, as I explained, the nerve's root means the chest must be examined. So the examination is a 2-minute look with a thin, flexible camera through the nose. It is not painful, and it is the step that actually answers the question. Let me give you the practical measures that help most voice problems, because a great deal can be done. First, hydration, which is genuinely the foundation, because vocal folds need a thin layer of moisture to vibrate efficiently, so drink water regularly through the day and consider steam inhalation, meaning simply breathing the steam from a bowl of hot water or a hot shower, which hydrates the folds directly and is one of the most effective simple measures there is. Second, stop the throat clearing. And this is genuinely important and rarely explained. Throat clearing is violent, it slams the vocal folds together forcefully, and it causes exactly the irritation that makes you feel you need to clear your throat again, so it is a self-perpetuating cycle. Instead, when you feel the need, take a sip of water, or do a silent, effortful swallow, or produce a gentle, breathy sigh, all of which achieve the same thing without the trauma. Third, address reflux if that is your pattern, using the measures I described previously: raising the head of the bed with blocks, not eating within 3 hours of lying down, smaller meals, and reducing alcohol and caffeine. Fourth, stop smoking. which is the single most important thing for anyone with a smoking-related voice problem, and know that the voice genuinely improves. Fifth, rest your voice when it is tired, and avoid whispering, which surprises people, because whispering is actually more strain on the vocal folds than speaking softly, so speak quietly rather than whispering. Sixth, avoid shouting and speaking over background noise. So move closer to people rather than raising your voice, and turn the television down when you talk. Seventh, rinse your mouth after every dose of an inhaled steroid and use a spacer if you have one. Eighth, watch the drying medications and consider whether any can be adjusted, and manage your environment with a humidifier in winter. And ninth, and this is genuinely worth knowing, voice therapy with a speech and language therapist is effective for a great many voice problems, including the aging voice. And there are specific exercise programs that strengthen the vocal folds, in effect resistance training for the voice, which have good evidence. And for the reduced voice volume of Parkinson's disease, there are specific and genuinely effective intensive voice treatment programs. So hydrate and steam, stop throat clearing, and replace it with a sip or a silent swallow. Treat reflux, stop smoking, do not whisper, avoid shouting over noise, rinse after inhalers, and ask about voice therapy. Let me say a word about why this matters beyond the inconvenience. Because people minimize it. Your voice is how you participate. A weak voice that cannot carry across a room means you stop contributing at family gatherings, you avoid the telephone, and you withdraw from groups, and that withdrawal is a genuine and underestimated cause of social isolation in later life, which in turn affects mood and, as I've discussed elsewhere, cognitive health. And there is a practical safety dimension too, because a person who cannot make themselves heard cannot easily call for help. And a voice problem can also be a swallowing problem in disguise, because the same structures protect your airway. So a breathy, weak voice, particularly one that sounds wet or gurgly after eating and drinking, connects directly to the aspiration risk I described in my swallowing video. So this is worth treating, and voice therapy exists, and a great many people who have quietly accepted a weak voice for years could have it improved. So a weakening voice drives real social withdrawal, has safety implications, and can signal a swallowing problem, and it is treatable more often than people assume. Let me be very clear about when to see a doctor. See your doctor, without exception, for hoarseness lasting more than 3 weeks, without an obvious explanation. And say the specific words. My voice has been hoarse for more than 3 weeks, and I would like my vocal cords examined. See your doctor urgently for hoarseness, together with any of these: difficulty or pain on swallowing, a lump in the neck, unexplained one-sided ear pain with a normal ear, coughing up blood, unexplained weight loss, or noisy breathing. Seek emergency care for difficulty breathing, for stridor, meaning a harsh noise on breathing in, and for a sudden inability to speak. See your doctor promptly for a sudden change in your voice, for a voice that has become breathy and weak alongside choking on liquids or a weak cough, which suggests a vocal cord palsy, and for hoarseness following any surgery to your neck or chest. See your doctor for a soft, monotonous voice that family have noticed, particularly alongside the smallness cluster I described in my tremor video, meaning smaller handwriting, reduced arm swing, and stiffness, since reduced voice volume is an early feature of Parkinson's disease. See your doctor if your voice fades with prolonged talking and recovers with rest, which is the myasthenia pattern. And see your doctor for a chronic hoarse voice with morning predominance and throat clearing, since silent reflux is common and treatable. And I want to add one specific and important point. If you have ever smoked, lower your threshold considerably and go at 3 weeks rather than waiting to see whether it settles, because that is the group in whom this rule most matters. So 3 weeks is the absolute rule. Hoarseness with swallowing problems, a neck lump, or one-sided ear pain is urgent, and breathing difficulty or stridor is an emergency. Let me paint you two pictures. First, picture a man of 69, an ex-smoker who gave up 11 years ago, whose voice had become gradually hoarse over about 4 months. It did not hurt. He could still speak perfectly well, it just sounded rough. And he and everybody around him attributed it first to a cold he had had in the autumn, and then simply to his age and his smoking history. He mentioned it in passing at an appointment about something else, at around the 5-month mark, and was referred for a look at his vocal cords, which found an early laryngeal cancer confined to one vocal fold. He was treated and did well, with his voice largely preserved, and the reason that outcome was possible is that it was still early. Now, 5 months is longer than 3 weeks, and he was fortunate. And the point of telling you this story is that his only symptom for months was that his voice sounded rough, and that is genuinely how this presents. Second, picture a woman of 72 whose voice had been hoarse for over a year, worst in the mornings, with constant throat clearing and a persistent feeling of a lump in her throat, and who had been given lozenges, throat sprays, and 2 courses of antibiotics over that period. Her vocal cords, when finally examined, showed the classic inflammatory changes of laryngopharyngeal reflux, and she had never once had heartburn, which is why nobody had considered it. Raising the head of her bed with blocks, not eating within 3 hours of bed, and a course of acid-suppressing medication resolved it over about 3 months, along with learning to stop clearing her throat. 2 people with a hoarse voice, one with a condition that needed finding urgently, and one with a condition that needed recognizing. And in both cases, what was required was somebody looking at the vocal cords. And let me speak briefly to those caring for or close to an older person. You are far more likely to notice a voice change than they are, because they hear their own voice from the inside, and the change is gradual. So if someone's voice has sounded different for a while, say so and ask how long it has been. Keep the 3-week rule in your head and apply it firmly with anyone who has ever smoked, because that is the group in whom this matters most, and the group most likely to dismiss a rough voice as an old smoker's voice. Notice the specific patterns. So a voice that is worst in the morning with constant throat clearing suggests reflux. A voice that has become soft and monotonous alongside smaller handwriting and reduced arm swing suggests Parkinson's and is genuinely often noticed first by family. And a breathy, weak voice with coughing on drinks suggests a vocal cord problem and connects to swallowing safety. Discourage throat clearing and whispering because both are actively harmful to the voice and both feel protective. And understand the social dimension, because a person who has stopped contributing at family meals may not have become quiet, they may simply have stopped being able to make themselves heard, and that is worth addressing rather than accepting. Let me draw this all together. Your voice is produced by 2 folds of tissue vibrating as air passes between them, and it requires them to close completely, to be supple and moist, and to have an intact nerve supply. Aging genuinely changes the voice because the muscle within the folds thins and they become slightly bowed so that they no longer meet completely, producing a weaker, breathier voice that tires more easily. But that change is gradual over years, and it is never the explanation for hoarseness that appeared over weeks or months. The common causes are viral laryngitis, silent reflux with its characteristic morning hoarseness and constant throat clearing, vocal overuse, smoking, dryness, and inhaled steroids. And the medical causes worth finding include an underactive thyroid, a paralyzed vocal cord, which can signal disease in the chest because of the nerve's extraordinary route down and back around the aorta, Parkinson's disease, myasthenia gravis, and cancer of the larynx. And above all of it sits the rule that hoarseness lasting more than 3 weeks needs the vocal cords examined. And the reason is that laryngeal cancer presents as hoarseness, and frequently as nothing else at all, is painless in its early stages, and is highly treatable when found early. So here's what I'll leave you with. First, know the 3-week rule and apply it to yourself without negotiation. because it is the single most useful piece of information in this video, and because a rough voice that does not hurt is exactly the thing people talk themselves out of mentioning. Second, if you have ever smoked, treat that rule as more urgent rather than less, because a rough voice is precisely what people in that group dismiss as normal for them. Third, if your hoarseness is worst in the morning with constant throat clearing and a lump in the throat feeling, think about silent reflux and try raising the head of your bed with blocks and not eating within 3 hours of lying down. Fourth, stop clearing your throat and stop whispering, because both feel protective and both are actively damaging. And replace the throat clearing with a sip of water or a silent, effortful swallow. And fifth, if your voice has simply weakened with age and you have stopped being able to make yourself heard, ask about voice therapy, because speech and language therapists genuinely treat the aging voice with exercise programs that work. And a great many people have quietly accepted a diminished voice for years without ever being told that. Your voice is how you take part, and its loss is isolating in a way that is easy to underestimate, and it is also occasionally the earliest and only sign of something that must be found early. So take care of yourself, notice how long your voice has sounded different, and if the answer is more than 3 weeks, go and ask for your vocal cords to be looked at. And because a persistent voice change requires a proper examination of the vocal cords to explain, please treat 3 weeks of hoarseness as your absolute reason to see your own physician. Treat hoarseness with swallowing difficulty, a neck lump, or one-sided ear pain as urgent, and treat any difficulty breathing or noisy breathing as an emergency. If this helped you, please give it a like and subscribe, because I share this kind of clear, practical guidance for older adults every week, and I'd love for you to keep watching with me.